Welcome back, everyone. It's been a long time I've been away, but it was for some unavoidable circumstances. I'm happy to have you back. Welcome back to my channel. Today we discuss about consent. Remember, this channel is a medical channel where we make it easy for the lay people to understand the medical terms, the medical procedures, and everything medical. For introductory purposes, consent to treatment means a person must give permission before they receive any medical treatment, test, or physical investigation. Basically, it's the patient's permission to the medical team before the procedure or an operation. An example is simply when you give your arm out and draw your sleeve up to the person drawing blood in hospital, blood for investigations. So consenting involves clear explanation on the treatment, its benefits and risks, available alternatives, allowing the patient to make informed decision. This process ensures patients have the right information in order for them to participate in the care and exercise their right to choose what happens to their body. The main aspects for informed consent will include explanation by the medical practitioner, most likely the doctor, the nurse, or health professional, who must explain the procedure in detail, including what it involves, potential benefits, risks, and any other alternatives available. It's also important that the explanation is simple and clear in order for the patient to understand well and be given an opportunity to ask questions. The language used during consenting a patient should be a language the patient understands very well. The patient must be allowed to voluntarily agree and without coercion to the procedure that the patient has also to be made aware of their rights, the right to agree or even refuse treatment even if it is recommended by the doctor. While not always required, a written consent, like signing a form, is often used as a way to document the agreement. The form is usually signed by the medical practitioner who is going to perform the procedure and the patient. Informed consent is therefore a requirement for various procedures like surgical procedures, medical tests, and some medical examinations. Informed consent is basically a legal and ethical requirement. This is because its fundamental principle of medical ethics, reflecting the medical autonomy and the right to make decisions about what happens or is done to their body. It is also a legal principle, and where there is failure to obtain a proper consent can lead to legal consequences for the healthcare provider or the institution where the procedure is being done. Therefore, the doctor or the medical practitioner should not assume what information is material to the patient, but should provide all relevant information to enable informed decision making. The doctor or the medical practitioner should therefore engage in a dialogue with the patient, not just to obtain a signature on the form, but also to ensure the patient clearly understands what they are signing for and what to expect. The patient should also be made comfortable, allowed time to think and digest all information, ask questions, and raise their concerns. It is important to note that if a patient lacks capacity to consent, a valid alternative process must be followed, such as obtaining consent from a legal guardian, or where there is none in an emergency situation, it will be two consultants making a decision in the patient's best interest. So who can consent for a patient's procedure? If they're able to, the consent is usually given by the patient themselves. But someone with parental responsibility may give consent for a child up to the age of 16 in the UK to have treatment, or in a situation where the patient is over 16 years and is incapable of giving consent, the parent will still give the consent. In the UK, if a child is considered as having capacity and is 16 years and below, they would still be allowed to give consent for their own procedure and treatment. There are 4 types of consent forms in the NHS England. There's consent form 1, consent form 2, consent form 3, consent form 4. But during my research, I came across consent form 5 from NHS Wales. In England, consent form 1 is a form used by an adult or 16-year-old or a competent child below 16 years to undergo a medical procedure or treatment. It is used to document their informed consent to the treatment or investigations proposed. Consent form 2, this is used when a person with parental responsibility agrees to a medical procedure on behalf of a child or a person under the age of 16 years. It documents the informed agreement for treatment of the child or the young person. For example, a 16-year-old who is autistic, the parents will be documenting on this consent form. Then there is consent form 3. This is a consent form which is very rare, but is used for procedures that are non-general anesthetic, like patients going for local anesthesia or something of the sort, but it's rarely used. Consent form 4 is the last consent form. This is for adults who may lack capacity to have informed consent, and it is signed by 2 consultants who one must be present during the procedure. For example, in an emergency where the adult cannot give consent for themselves and the procedure has to be done, like in trauma, 2 consultants will sign this consent form on behalf of the patient so that the procedure is done. During my research, I came across consent form 5 from the NHS Wales. This consent clearly explains that it is basically for everyone who's with capacity to give informed consent for blood transfusion, but has refused, including Jehovah's Witness. This, therefore, is a refusal consent to blood transfusion only and must not be used for any other procedures or treatment. There are requirements for obtaining a valid consent. These include 4 core criteria that must be met. Number 1, the patient giving the consent must have capacity. The second is the consent must be given freely. The third, the consent must be sufficiently specific to the procedure or treatment proposed to the patient. And the fourth and the last is the consent must be informed. For purposes of elective surgery or procedure, that means a procedure that has been planned way in advance before the date, a consent form may be signed and therefore will require a confirmation. This is an agreement by the patient that they are still happy to go ahead with the procedure. A surgical consent in the UK is valid for 48 hours or more, but differs from every trust, from the date it was signed, and if it is over, then reconfirmation is needed. Planned surgical consents are done way in advance to allow the patient time to think and make informed decision. Consenting is a process, and the patient has the right to withdraw if they change their mind. And the withdrawal has to be documented by the medical practitioner. In case the patient still wants to have time to think about the procedure, they should be allowed time to think about the procedure before the procedure is done if it is not a risk to their health. There are other situations where consent may not be needed. Some exemptions where the treatment may go ahead without the patient's consent, especially in an emergency to save their lives, and when they are incapacitated. For example, in an emergency where a patient does not realize what is happening to them, the procedure will go ahead so that they save the life of the patient. It may also happen if they immediately need another procedure during an operation. For example, during surgery, when they discover there's something else that needs to be done that they were not aware of, they will proceed with the surgery and then discuss with the patient after that. The has to be a clear medical reason, though, where waiting for the consent would be unsafe. This can also occur in situations where a patient needs hospital treatment for severe mental health, such as schizophrenia, bipolar disorder, or dementia, and lacks capacity to consent to treatment of their mental health. This is under the Mental Health Act. Also, in such cases, a relative or a person's closest relative or approved social worker must make an application for the person to be kept in hospital, and 2 doctors must assess the patient. And lastly, if you believe you received treatment you did not consent for, you can make an official complaint. In summary, informed consent is a process in which a health personnel educates a patient about the risks, benefits, and alternatives of a given procedure or intervention. The history of informed consent in medicine is rooted in an evolution of ethical practices and legal standards surrounding patient autonomy. We've now come to the end of this video. Comment below. I don't know what your country or your hospital or what types of consent forms they use. We can share, and if you're still in the NHS and you think there's anything you need to add, let's meet in the comment section below. Thank you all for listening and coming by. I hope to meet you in the next video. Remember, this channel is purposely for educating and information. When you're in hospital and they're consenting you, listen to the advice of the medical practitioner who is discussing with you the procedure that you're going to undertake. Hope we meet to see you soon. Bye.